Immunisation can protect people from the specific diseases we saw in the last chapter. The vaccines boost the body's own defence system known as the immune system. Vaccines are biological products that help a body prepare in advance to fight illnesses and potentially deadly diseases. They give the body a preview of the bacterium, virus or toxin, allowing it to learn how to defend itself. Sometimes vaccines prevent one disease. Sometimes they are combined to protect against several diseases with one shot. We will now look at the vaccines commonly used in Africa and talk about their appearance, means of administration and possible side effects. Immunisation with BCG vaccine at birth or as soon as possible afterwards can protect against TB meningitis and other extrapulmonary disease. Unfortunately, it does not protect against pulmonary TB. The vaccine comes in powder form and must be reconstituted with diluent before use. Only the diluent that matches the vaccine can be used. The reconstituted vaccine must be managed like other vaccines and kept at a temperature of +2 to +8 degrees Celsius. It should be discarded after 6 hours or at the end of the immunisation session. Normally, when BCG is injected intradermally, a small lump will appear under the skin. This usually will disappear within 30 minutes. After about 2 weeks, a red sore forms, which heals, leaving a small scar. This indicates the child has been successfully immunised against TB. Immunisation with 3 doses of oral polio vaccine, or OPV, by 6 months of age is the best way to prevent poliomyelitis. An additional birth dose is given in endemic areas. They are usually given as part of the immunisation schedule at birth, then at 6, 10 and 14 weeks. In an effort to eradicate the disease, supplementary immunisation with an additional 2 doses, 1 month apart, can be given to all children more than 5 years old, regardless of the doses they've had previously. There are no significant side effects from the vaccine in most cases. The vaccine should be stored at +2 to +8 degrees Celsius or can be frozen for longer storage. While there are no effective treatments, hepatitis B can be prevented through vaccination. The vaccine presents as Hep B vaccine by itself or is combined with DTP as quadrivalent vaccine, or most often now with DTP and HIV as pentavalent vaccine. 3 intramuscular injections of the vaccine are required at 6, 10 and 14 weeks of age. In addition, a dose at birth of Hep B vaccine alone is recommended. The combination vaccine should not be used at birth. Soreness and redness at the injection site can occur, and mild fever can last 1 or 2 days after injection of this vaccine. The DTP vaccine is made from diphtheria toxoid, tetanus toxoid and pertussis vaccine. As said earlier, a combination vaccine containing DTP, Hep B and HIV vaccines, pentavalent vaccine, is often used. The best way to prevent these dangerous diseases is by immunising with 3 doses of the vaccine at 6, 10 and 14 weeks of age. A booster dose should be given between 12 months and 6 years of age. The DTP, Hep B, HIV vaccine should be shaken before giving it and should be stored between +2 and +8 degrees Celsius. It must not be frozen. The vaccine must be given intramuscularly. Reactions to the vaccine are generally mild and side effects include fever, soreness and prolonged crying. Tetanus vaccine is part of the DTP vaccine, but children over 7 years old, adolescents and adults should receive boosters in the form of tetanus toxoid, TT, or TD vaccine, tetanus toxoid combined with low-dose diphtheria toxoid. Pregnant women and all women of childbearing age should receive at least 2 doses of TT vaccine 4 weeks apart. A 3rd dose should be given at least 6 months after the 2nd dose of TT. This protects the mother and enables tetanus antibodies to be transferred to the baby. The HIV vaccine prevents meningitis, pneumonia, epiglottitis and other serious infections caused by Haemophilus influenzae type B bacteria. The vaccine is often combined with DTP and Hep B to produce the pentavalent vaccine, DTP-Hep B HIV. Monovalent HIV vaccine or HIV vaccine in combination is given intramuscularly at 6, 10 and 14 weeks of age. Vaccination of children older than 24 months is not recommended due to the limited burden of disease in that age group. The HIV vaccine is very safe and causes few side effects other than occasional soreness and fever. Storage should be in the range +2 to +8 degrees Celsius. Streptacoccus pneumoniae, also called pneumococcus, is a bacterium found in your nose, throat and windpipe that can cause pneumonia, sinusitis, middle ear infection, meningitis and septicemia. Highly effective vaccines have been developed to protect against a number of the serotypes of this bacterium. A series of 3 injections intramuscularly is given at 6, 10 and 14 weeks of age. Injecting this vaccine at the same time as DTP Hep B HIV simplifies management for both mother and the health staff. A booster dose after 12 months may improve the immune response. The World Health Organization recommends that countries with a high prevalence of HIV introduce this vaccine as soon as possible. 3 pneumococcal conjugate vaccines are available: PCV7, PCV10 and PCV13. The numbers indicate the number of serotypes included in the vaccine. PCV7 will be phased out. PCV10 is available in a 2-dose vial and contains no preservative. It should be discarded 6 hours after opening. PCV13 is available as a single-dose vial without preservative. Both vaccines are fully liquid, are given intramuscularly and should be stored between +2 and +8 degrees Celsius. Vaccination is a complement for other pneumonia control measures like case management, better nutrition, including exclusive breastfeeding for 6 months and zinc supplementation, and reduction of exposure to risk factors such as tobacco smoke, indoor pollution, etc. The current rotavirus vaccines, Rotarix and Rotatec, provide very good protection against rotavirus infection, and in particular against severe rotavirus diarrhea. They do not protect against diarrhea that results from other causes. The Rotarix vaccine is given orally in 2 doses at 6 and 10 weeks of age. The Rotatec vaccine is given orally in 3 doses at 6, 10 and 14 weeks of age. As many vaccines are given at 6, 10 and 14 weeks of age, remember to give the oral vaccines first, followed by the injectable vaccines. There are few adverse effects associated with the vaccines. One very rare but serious side effect is intussusception, a bowel obstruction caused by one part of the bowel sliding into an adjacent part. Caregivers should be informed about this possibility and told how to recognize the signs such as stomach pain, severe crying, vomiting, blood in stools, weakness and irritability. Rotavirus vaccines should be part of a comprehensive strategy to control diarrheal diseases and include improvement in hygiene and sanitation, zinc supplementation, administration of oral rehydration solution, and improvement of case management. Measles vaccine is a live vaccine containing attenuated virus. It is a vaccine on its own or is combined with Rubella, MR, or as measles, mumps, rubella, MMR combination. The vaccine presents as a powder and must be reconstituted with its own diluent. It should be stored along with its own diluent in a refrigerator at +2 to +8 degrees Celsius. The vaccine should be injected subcutaneously. The recommendation now is to reach all children with 2 doses of the vaccine. A first dose at 9 months and a second dose at 15 to 18 months as part of routine immunisation or during immunisation campaigns. If older children or adults have not been immunised, they too should receive the measles vaccine as soon as possible. This vaccine should not be given to pregnant women or those with congenital or acquired immune disorders. There is no evidence to show any serious risk in giving measles vaccine to HIV-positive children. Mild reactions to the vaccine are not uncommon. Pain and swelling at the site of injection, fever, and rash, which appears 5 to 12 days after vaccination, are mild reactions that are not uncommon. The rash usually lasts 2 days. Most countries use combination vaccines for rubella and measles, MR, for rubella, measles and mumps, MMR. These are live virus vaccines. The vaccine comes as a powder that needs to be reconstituted with its own diluent. A single injection subcutaneously of rubella vaccine at 9 months is normally enough to provide protection, but a second dose at 15 to 18 months can be given when the combination vaccines MR or MMR are used. Adolescent girls and women of childbearing age are recommended to receive 1 dose of the rubella vaccine if not previously vaccinated. Pregnant women or those planning pregnancy within 1 month should not be given rubella vaccination. Fever and a rash are common mild reactions. Rare, more serious reactions include a temporary form of arthritis in young women. Yellow fever vaccine is a live virus vaccine that's recommended as part of routine immunisation programs in countries where the disease is endemic. The vaccine comes as a powder that is reconstituted with its own diluent. The vaccination schedule is 1 injection subcutaneously, which should be given with the measles vaccine at 9 months. It is given using a separate syringe from the measles injection and at a different site. Contraindications include egg allergy, immune deficiency from medication or disease, symptomatic HIV infection, and pregnancy. Mild reactions from the immunisation include headache, muscle pain, and mild fever. Serious adverse reactions are rare. The largest burden of meningococcal disease occurs in the meningitis belt, an area in sub-Saharan Africa stretching from Senegal to Ethiopia. The disease is mainly caused by a bacterium, Meningococcus group A. A new conjugate meningococcal A vaccine is available, Venafrivac. The vaccine comes in dry powdered form and needs to be reconstituted with its own diluent. Vaccination is with a single intramuscular injection of the target age group of 1 to 29 years old. Mild reactions such as fever and soreness can be expected following administration of the vaccine. Serious side effects are rare. 2 effective HPV vaccines are currently available to prevent anogenital cancers, of which the most important is cervical cancer in women. The HPV vaccine is most effective if given to adolescent girls 10 to 13 years old, before their sexual debut. The transmission of anogenital HPV is by sexual contact. Both vaccines, Cervarix and Gardasil, protect against anogenital precancers and cancers due to HPV 16 and 18. Gardasil protects also against anogenital warts due to HPV 6 and 11. The vaccines should be given intramuscularly as 3 injections. First dose, then the second dose 1 or 2 months later, and a third dose 6 months after the initial dose. The vaccines can be co-administered with other vaccines using separate syringes and different injection sites. No serious adverse effects have been reported, and only mild side effects such as pain and swelling at the injection site have been noticed. HPV vaccination may reduce the lifetime risk of cervical cancer by 35 to 80%. The HPV vaccines are not recommended for pregnant women. Screening for cervical cancer remains necessary as not all cancer-causing HPV types are contained in the vaccine. Since breast milk is a natural source of vitamin A, promoting breastfeeding is the best way to protect babies from vitamin A deficiency. For deficient children, the periodic supply of high-dose vitamin A in swift, simple, low-cost, high-benefit drops has also produced remarkable results. Mortality has been reduced by 23% overall, and by up to 50% for acute measles sufferers. There are no side effects from vitamin A when delivered according to the schedule. Cultivating a garden and food fortification with vitamin A could achieve long-term positive results. There are a few reasons not to immunise a child or an adult. Very rarely, some people will have an allergic reaction to vaccines, perhaps generalised hives, difficulty breathing, swelling of the lips, tongue or throat. They should not be given further vaccinations. If a child appears to have AIDS, then do not administer the BCG vaccine. And yellow fever vaccine should not be given to symptomatic HIV persons. The others can still be given. And finally, if a mother is worried that her baby is too sick for immunisation, do not give it. Suggest she takes her baby to the doctor and ask her to come back when the baby is well. Remember to follow up if she does not return within a few weeks. Otherwise, this baby may miss vital vaccination. If the child is taken to hospital, the vaccine should be given before discharge. If a child has diarrhea when OPV is given, schedule another dose 4 weeks later to ensure the child is protected against the poliovirus. In all other cases, immunise according to the schedule.